Hey, well, thank you so much for joining us here this morning, and good morning, and welcome to Prince Albert. On day one of the provincial campaign, the Saskatchewan Party announced our plan to make life more affordable for everyone that lives in Saskatchewan, with the largest income tax reduction since 2008. On day two, just yesterday, we announced our plan to make life more affordable for post-secondary grads, new and young people that are entering their career in a community in Saskatchewan, by increasing by 20% the graduate retention program. And today, we are announcing our plan to make life more affordable for families across this province by increasing the active families benefit. There are so many benefits to having our children involved in sports and artistic activities. And while Saskatchewan today is the most affordable place in Canada to live with the lowest inflationary rate, we understand that our Saskatchewan families here do face cost of living pressures as well. And we want our kids, we want our children today and into the future to have the opportunity to skate, to dance, to play hockey, and to play soccer in a facility just like this in Prince Albert at the Alfred Jenkins Fieldhouse. The Active Families Benefit was created by your Saskatchewan Party government to help families with the cost of just those activities. And today, I'm happy to announce that a re-elected Saskatchewan Party government would double the Active Families Benefit from $150 today to $300 upon our opportunity and the honor to form government in this province. The benefit for a child that is living with a disability would also double from today $200 to $400. We also want more families to benefit from the Active Families Benefit. And so we will increase the total family income threshold to qualify, which today is $60,000. We will double that as well to $120,000. And we also want to make this investment in our children. We are only able to make this investment in our children due to the strong and growing economy that we have in this province. We all know that when our kids are involved in sport, they are healthier and they are happier. And we want to ensure that that opportunity is there for all kids in this province into the future. Many of you watched the Summer Olympics and the Paralympics just a few months ago. And we were also proud as Saskatchewan residents and as Canadians to see so many Saskatchewan athletes find success at those games. And we want our kids to be able to dream big today and tomorrow and to follow those very dreams that they have. And I know that we have so many more future Olympians here in Prince Albert or in Saskatoon, Regina, as well as all of the rural communities across Saskatchewan. And we want to ensure that they have an opportunity to participate. So whether it be lowering provincial income taxes in the province for everyone, whether it be increasing the graduate retention program for those that are entering a new career in Saskatchewan, or whether it be doubling the Active Families Benefit and making it more accessible to more children and more families, we are making every effort to make life more affordable for Saskatchewan families. And this is all of our plan to keep our economy strong and to build a brighter future for everyone that lives here. Thank you very much for joining us here. And if you have any questions, seeing none. I have the cost. It's budgeted at about $4 million, and this will go into, as I said, our costing platform, which we will release in the not-too-distant future, a fully costed platform with a return to balance in the province of Saskatchewan. Again, this is a difference between the choices that we have. We have the opposition that has committed to an irresponsible $4 billion in excess spending with no plan on how they would pay for it. And at the end of the day, there are only a few ways that a government can pay for it. And one that is being suggested by the NDP party is to cancel projects like this Victoria Hospital, cancel projects like the recreational center here in Prince Albert, and they've already committed to cutting police officers that keep our communities, including this community of Prince Albert, safe, and have been committed to over 500 officers, an increase of over 500 officers by the Saskatchewan Party government recently.
Can you comment on, there's a news release from SARMA this morning that talks about how much municipalities actually return to the province because of paying PST on things like construction. So is this something that the home government in the future would look at addressing? I know that the cities have challenges.
Yeah, we've seen some different conversations around whether it be a temporary reduction of the gas tax or the PST, and first and foremost, municipalities are a primary beneficiary of the PST through the municipal revenue sharing program here, where there's close to $300 million that is transferred to our municipalities through that municipal revenue sharing that was asked for years by not only SARM but by SUMA of the NDP government, and was delivered very shortly after the Saskatchewan Party had the honour of forming government in 2007. And so they are the primary beneficiaries. They also, I would say, with respect to the benefit of having an active and attractive investment environment in Saskatchewan, our natural resources that are driving the Saskatchewan economy are located in our rural municipalities. And there is opportunities there as well that SARM and individual municipalities where they are benefiting from that activity, whether it be through property tax revenue or what that might be, through that activity of expansions in the oil and gas industry, the potash industry, the mining industry more general, as well as today we're seeing significant expansions in the agricultural value-added industry. And so I think when you look at the suite of the investment environment, the fact that the taxation, in this case the PST, a portion of that is returned to those very municipalities, that unlike anywhere else in the nation of Canada, we are in a very positive environment to foster the growth that we are seeing, and the growth of our economy, the growth of our communities, and the growth in those very municipalities. And so we're always open to discussing, whether it be with SARM or SUMA, with respect to how we work together to continue on ensuring that we have that positive investment environment, but also to continue to ensure that we are working together to provide the public services that people require in the communities and expect in the communities where they live, whether they be rural or urban. But to make significant differences to the PST revenue, whether it be that would impact the provincial revenue, or whether it would be to impact the municipal revenue sharing formula that we have, would be nothing short of irresponsible at this point in time. It would reduce the municipal revenue sharing that the municipalities receive, and it would reduce the ability for a government to invest in the very services that we are investing in that are benefiting people that live in our rural areas, and that's access to healthcare. It's building new schools, with 28 new schools under construction or in the planning phases today, and that is coming from the growth and the strength of our economy and the provincial revenue sources that we have.
Carla Beck was here yesterday, and she talked about a lot of things, but one of the things she mentioned was that the Sask Party hasn't done enough for voters in rural areas. She cited rural crime and the difficulty attracting nurses and doctors to rural areas as two of the things she thinks the Sask Party hasn't done well. For voters in the Prince Albert area, not just Prince Albert, the surrounding area, why do you think they should vote?
Well, let's compare the records, and actually I think you can translate the NDP record into the plan as you can with the Saskatchewan Party record into our plan. And so their record is one of closing hospitals and closing schools and firing doctors, nurses, and teachers. And that is their record as government, and with the irresponsible spending that they have put on, uncosted spending platform that they had put forward, we would very shortly be faced with those very decisions again. And so closing and underfunding, closing schools, closing hospitals, and underfunding those public services is not only the NDP's record, it is their plan. They also have a plan to cut police officers, and they have that on the record, and they're going to replace those police officers with doorbell cameras. And I would ask and implore you to walk down the street of Prince Albert or Saskatoon or Regina and say, we're going to take away some of your police officers, but we're going to fund a doorbell camera for your home, and that's going to keep you safe. Saskatchewan people know that just simply isn't true. And so when it comes to investing, as I said, in rural communities and all Saskatchewan communities, there's 28 schools that are being built today. An education sector that has experienced a 9% lift in funding this past year. A healthcare sector that is seeing new hospitals built, St. Paul's Hospital in Saskatoon. We're seeing a Weyburn Hospital. We're seeing right across the parking lot here a significant investment in not only an expansion and replacement of the Victoria Hospital, but a significant expansion in services and the most ambitious health human resource plan in the nation of Canada to back up the hiring plan that we need in that particular facility. When it comes to community safety, which is also too important on both people that live in rural areas as well as here in Prince Albert or our larger urban centres. You've seen a government since 2011 that has funded or actively committed to funding over 500 municipal RCMP and provincial police officers today. Over 190 RCMP police officers have been added since 2011. 180 committed to recently and waiting for the federal government to come forward with their 30% share, of which I expect they will. Over 100 municipal police officers coming into our community, 17 into the community of Prince Albert, and 70 provincial police officers, marshals that will be based out of Prince Albert but will serve Saskatchewan communities across this province. That is part of the Saskatchewan Party's plan to keep communities safe, to keep the people that live in our community safe and allow them the opportunity to come to a park like we have here at the Alfred Jenkins Fieldhouse or any park in their community and go for a walk after supper and feel safe. A doorbell camera isn't going to do it. That's the NDP plan. The Saskatchewan Party plan has an active plan to ensure that our communities are safe today and into the future.
Kellerbeck did mention yesterday about the cuts in the gas tax first day of her coming to the office. How did that have effect on the economy? If she comes in and she tries to give her at least 1 year or 6 months of gas tax reduction?
Well, first, I think, again, this is a significant difference between the two parties that can form government, is you have one that is going to do a temporary tax reduction to the gas tax, less than $400 impact to those people that drive in this province. It certainly does not compare to the largest single income tax reduction that the Saskatchewan Party has introduced since 2008. And here are the differences. One is $400 temporary. One is $3,400 for a family of four, $3,100 over the next 4 years for a seniors couple. Two, the temporary reduction of the gas tax, not only will it cut our highways budget, but it is only going to be available to those that drive, whereas the permanent reduction in the income tax, the most significant reduction in income tax proposed by the Saskatchewan Party, is going to impact everyone in Saskatchewan. When you look at the four metrics that would be introduced, it will impact everyone in the province of Saskatchewan. And so putting forward an irresponsible temporary gas tax reduction that will do nothing more than cut our highways budget and impact large trucking companies and those that drive, versus across-the-board permanent income tax reduction of $3,400 over the next 4 years for a family of four, most certainly is going to have a larger impact on Saskatchewan people, and is going to impact all Saskatchewan people as opposed to just those that might be driving.
I know you just spoke on this, but just to kind of expand on how you plan to combat rural crime, you spoke with the mayor of Loon Lake, who's kind of concerned about rising crime rates.
Mayor of where? Sorry? Yeah, and I believe the minister has also spoken with the mayor with respect. And this is an example of where, when they are up and functioning, the Saskatchewan Marshals would have a role to play in supporting our RCMP officers in the community of Loon Lake or any other Saskatchewan community. And again, this is a provincial police force of which the NDP is committed to cutting and replacing with the doorbell camera, which is laughable, nothing short of laughable. And so the Saskatchewan Marshals, when they're up and running, would be able to deploy into a community like Loon Lake, support our RCMP officers, or deploy into a community like Prince Albert, Saskatoon, Regina, Moose Jaw, and support our municipal police forces as well when they are faced with a significant issue of crime at a period of time. That's why we have committed to funding not only the 70 provincial marshals that will be based out of here, could be deployed to Loon Lake, but that's why we have committed to deploying and funding over 100 municipal police forces in the 7 communities that use municipal police, and I've also committed to over 180 RCMP officers to help and to bring recruits and additional folks into communities like Loon Lake, as well as any other rural community across the province that utilizes RCMP. Over 500 officers since 2011 have been committed to and funded by the Saskatchewan Party. The NDP want to take those officers away, and they want to replace them all with a doorbell camera, which isn't going to help the folks in Loon Lake. It isn't going to make them feel any more safe, nor is it going to help anyone else in this province. It's an irresponsible platform commitment.
Can I beg you to mention about having 3,000 housing units unoccupied?
Yeah.
And they're talking about homelessness.
Yeah.
So how do you want to overcome that?
Yeah, and those can be available for transitional housing as we put the programs together. And I would point to Regina, to a pilot program that has started where we have turned over about 15 or 20 of those houses to an organization to bring into a rent-to-own program for just that type of transitional housing. And so there are steps when you when we discuss the conversation around homelessness, which does extend back to and is often part of the discussion around mental health, and as I say all too often, addictions challenges that we're facing not only in our province and nation, but our communities and with our friends and families. And so the effort and the initiative that the Saskatchewan Party government has undertaken is one that is really twofold. First is to build out the recovery opportunities for our friends and our family members that may have, succumbed to mental health challenges that are very real today and all too often maybe living a life of addictions. We need those recovery opportunities, and we're building out those 500 intensive recovery beds. We need access to those recovery opportunities. That's part of the urgent care investment that you're seeing in Regina up and running and coming with a unique partnership with Atakakuk Cree Developments in Saskatoon. Part of that is an intake for people to access those recovery beds. So number one focus is offering those recovery opportunities so that people can find their way to a better life and find their way to a housing unit, and we're working on transitioning some of our units into that space. Second is the previous discussion. We need to ensure that we are making every effort to get the drugs out of the hand of the drug dealers and getting the drug dealers out of our communities. And that's where the additional 500 police officers are coming into play, is to make our communities safer. We have an initiative for safer communities and neighborhoods, and this is what is going to help us achieve that, is over 500 additional officers, not a doorbell camera like the NDP have committed to.
Saskatchewan Union of Nurses recently said, RUH is at 350% capacity. There's some problems with overcrowding, they say. What would you say to Saskatchewan residents and healthcare workers who find this concerning?
I would say that this is a challenge, and it's a Canadian challenge. Human resources, and the people that are offering services, whether it be in rural facilities or whether it be in our urban facilities, it's a Canadian challenge, and it's one that we talk about at the Premier's table often. And it's one that we talk about how can we work together to not only strengthen the healthcare that we're offering at the provincial level, but collaboratively work together so that we have a strong national healthcare delivery system in the nation that we live in, Canada. In Saskatchewan, what we have done is, first is when it comes to remuneration of our healthcare employees. They are competitive rates and among the strongest remuneration rates in Western Canada. Two, we are making every effort, whether it be through the revamping of our Sask Docs to a medical healthcare professional recruitment team, whether it be, as I say, the most ambitious health human resource plan in the nation, right here in Saskatchewan, funded by over $300 million in the most recent budget, to advocate, to retain, and to recruit people into our healthcare system, and to expand the training opportunities that we have. And that is happening with over 800 additional seats in various healthcare disciplines that have been added into our Sask Polytech, SIT, the two universities, as well as our regional colleges. And there needs to be more of that effort and initiative, and we would commit to ensuring that happens into the future. And we are starting to have results, but there's more work to do. The last 18 months, we've seen over 1,300 nurses being hired from about 1,000 from across Canada, Canadian grads, and about 350 from overseas, offering services and working in a Saskatchewan healthcare facility today. And so, admittedly, there is much more work to do here, and the Health Human Resource Plan has not certainly found its way to the end of its work. And we are committed to continuing to do that work, continuing to offer the services, whether it be in rural Saskatchewan or whether it be in our large urban centres, and working alongside not only the collective bargaining units and groups that we have through whether it be the nurses task force that will focus on patients and patient-focused delivery of healthcare in the province, but also working with frontline folks in our healthcare facilities and working with the community leaders as well to ensure that our recruitment teams and our retention teams, and where we are providing the incentives for people to come to and offer those healthcare services, is sound and in the right places into the future. And so there are some successes coming. Or some successes that we've experienced in the way of expanding our training opportunities, bringing actual nurses of many designations into our healthcare facilities, over 1,000 of them in the past 18 months, but there's much more work to do as well.
Who makes with the timeline for more change to be seen?
Pardon me?
Who makes with the timeline for more change to be seen, some more progress to be seen?
Well, I think ongoing. I really do. And is there an end to that timeline? I'm not sure there is at this point in time. one thing that often isn't discussed is this last year the health budget was increased by almost 11%, well over 10%. We have more people in the province. We have more people in Prince Albert, Saskatoon, Regina, but also many of our rural communities. And when you drive from Prince Albert to Saskatoon, you see those communities that are growing. You see, Rostern, for example, is going to have a new facility built in there. We're working with the communities of Warman and Martinsville to expand the healthcare access that they have in there. You see the St. Paul's facilities being expanded, and those larger urban centers are very much a part of that health human resource recruitment plan. And so there's more work to do here. I don't think there's a timeline commitment on when, we're finished, we've achieved what we need to achieve. I think this is going to have to be an ongoing discussion and an ongoing effort on, how do we ensure that we're minimizing the disruptions, and other provinces are experiencing at least as much, and in some cases more disruptions than unfortunately our communities are here. But we're committed to doing that work, and doing that work alongside all of those involved in healthcare.
The Meadow Lake Tribal Council today said that 2 provincial government workers were sent home for wearing orange shirts.
Yes.
Do you agree with that? And what do you think of their call to make this a statutory holiday?
Yeah, so I've commented on the statutory holiday previously, as we had that discussion is never off the table. But however, where Saskatchewan is, we have one, if not the highest number of statutory holidays of any province. And I use the example of Manitoba that does not have Remembrance Day as a provincial statutory holiday, and in no way does that mean that Manitobans don't honor their veterans not only on Remembrance Day but each and every day. So that discussion is never not happening. I would say it will happen on an ongoing basis, but we do have, if not one of the largest numbers of statutory holidays in the province today, and there's a number of impacts to that decision that are broader and beyond government. With respect to the orange shirt, a couple of orange shirts being worn in the courthouse on Monday, we passed a private member's bill actually in the legislature that was focused around wearing poppies in a courthouse, or wearing poppies on Remembrance Day. And I would say that there is a discussion that should be had around that piece of legislation and what happened the other day with the orange shirts being removed from the courthouse. And so I won't preclude what the end of that discussion and what those decisions might be, but I would be happy to entertain that discussion not only with MLTC but other Indigenous leaders, PAGC and others across the province on maybe looking at the model that the government took with the legislative action on being allowed to wear poppies in a courthouse or place of work, that we maybe look at extending that to orange shirts and other parts of that conversation.
Sure. And finally, we've spoken with people with disabilities. They say it's very hard to make ends meet, from housing to cost of living. Are you planning on increasing any disability benefits?
Well, just today, the active families benefit would be a part of that, doubling the active families benefit, and then also doubling the income threshold on when a family would qualify for the active families benefit. And we want more families to qualify for this benefit, and we want more families that maybe have a child that is living with disabilities to qualify for this benefit, so that they can aspire and participate to the greatest degree possible, and to all that they would choose to. And so this is one example of that. I would say this is a government that has often talked about making Saskatchewan the very best place to live for those that are living with disabilities. That commitment remains today. Recently, I've had discussions with a number of organizations that offer, I would say, some just incredible services in this area. Elmwood, we're at an announcement in Bigger, for example, with Farmer and the Dell, all offering incredible services and supports for not just individuals but families that have children that are living with disabilities. And I think there is a real opportunity for additional discussions in that space and providing those supports. And the goal is for everyone in Saskatchewan to be included, and for everyone in Saskatchewan to have the opportunity to attain all that they aspire to, and that includes, and most certainly includes, making our province the best place in Canada to live for those in disabilities. And today's announcement is one small step in our continued effort to achieve that.
I know we spoke on healthcare already, but just specifically, I know there's some registered nurses and doctors planning to rally in Saskatchewan legislature at noon. What would you say to those healthcare workers who are
Yeah, I would say that we are committed to that as well. Change and improvement in not only their work environment, but then the ability for all of them to offer the services that Saskatchewan people expect in our healthcare facilities, and that's why you've seen us move with the most ambitious health human resource plan in the nation. That's why you've seen us commit to expanding our training seats in the province, across the province, by over 800. You've seen the commitment to the College of Physicians, or sorry, the College of Medicine at the University of Saskatchewan. I think when you look at the historic commitment of this government, right up to and including this last budget, over 10%, almost 11% increase to the health budget. This is a government that has been fully committed to not only working with frontline staff, our organizations across the healthcare sector on new and innovative ways to offer healthcare, but then putting the funding behind those discussions. The Health Human Resource Plan has received over $300 million in funding. The Urgent Care Centre that's up and operational in Regina is seeing a similar number of walk-in people each and every day that our emergency rooms are. And is taking people out of those emergency rooms with the ailments that they may have. And often we see folks that have an illness or an injury that maybe doesn't quite require an emergency room attention, but it is more urgent than waiting for 7 or 9 days to see their physician. That's the gap that those urgent care facilities are filling. And I would say in Regina, they're seeing a 100 to 150 people a day, which is comparable to what the 2 emergency rooms are seeing on their own. And so looking at delivering healthcare a little bit different is something that we're most certainly open to. And going to replicate the success of that urgent care center in Regina and Saskatoon very shortly. And then I think we'd have discussions, if we have the honor of forming government on October the 28th, on how we would expand that into other communities across the province. That's one example. Thank you, everybody.